All right, I will get started with some words of welcome and housekeeping items to give our wonderful speakers as much time as possible to present. So good afternoon, and thank you so much for joining this webinar, Nursing Retention Toolkit, a primer for nurse educators. My name is Christine. I am a member of the CASN team. And before I jump into some more information about today's webinar, I'd like to take a moment to pay respect to the land on which I am situated. CASN's national office, which is where I'm working from today, is located in Ottawa on the unceded territory of the Algonquin people. Humans have been living here along the watershed of the Kitchissippi, or the Ottawa River, for over 8,000 years. Currently, the Ottawa area is part of a land claim being negotiated between the federal provincial government and the Algonquins of Ontario, which is composed of 10 Algonquin communities. Now I will start going through a few housekeeping items. Today's webinar is going to begin with a presentation and will conclude with some time for questions. To submit your question, please use the Q&A button at the bottom of your Zoom window. We welcome questions in both French and English. You're welcome to use the chat function to discuss and share with your fellow participants, but the chat will not be monitored for questions for the presenters. So please do ensure you're using that Q&A function with the button at the bottom of your Zoom window. Please note that today's presentation will be recorded and posted on CASN's YouTube channel for future viewing. We are also going to circulate the slides to everyone that registered for this event. And with that, I'd like to thank all of our speakers for coming together for today's presentation. We are honored to have with us Dr. Lee Chapman, Canada's Chief Nursing Officer, Yassi Jacob, the past president of the Canadian Nursing Students Association, and Dr. Jean-Daniel Jacob, CASN's Executive Director. And with that, I will turn things over to Dr. Chapman.
Thank you so much. Bonjour tout le monde. I'm really delighted to be here. This is now the second webinar that we have had to really provide a bit of a primer on the Nursing Retention Toolkit, in particular, what it may mean for faculty, for students, for educators, and all of those who may be interested in the Nursing Retention Toolkit from the lens of nursing education. And delighted to be joined by my colleagues from the Canadian Association Schools of Nursing and Canadian Nursing Students Association. I thought just to begin, I would talk very briefly just about my role as Federal Chief Nursing Officer. I've been in the role now, we can go to the next slide, please, slide 1. Thank you. So I've been in the role now for about 2.5 years. The role of the Chief Nursing Officer was reinstated in August of 2022. And the role is really divided into 3 parts. One, to provide strategic advice. It sits within government and within the health portfolio or the health policy branch of Health Canada. And the role is really to provide advice from a nursing perspective. Of course, within our federation in Canada, we play a convening role federally in working very closely with all of the provinces and territories. And then I represent the government of Canada, both within Canada and internationally. And I know we have some international colleagues here today, so welcome to all of you. And just actually, before we proceed, we wanted to also get a sense of where folks are from. So we will just be putting up a quick poll to have you identify your location and your role. And then we will see that populate. Really nice to see so many participants who are joining us today. Okay, and then we can go to the next slide and I'll turn it to my colleague.
Alrighty, so the CNSA has been the national voice for nursing students in Canada for well over 50 years. there are various activities the CNSA engages in terms of in-person conferences, educational events, and advocacy to various national nursing organizations like the CNSA, like the CFNU, sorry, CNA, and CASN. We also played a role in the development of the toolkit, as you can see in the photo on the right, where during my time as president of the association, we were able to provide a student voice in the development of this project. And if you go to the following slide, please, you can see some of the activities that various members of the association have gotten up to in recent years, including attending the recent ICN that happened in Montreal in 2023, as well as being involved in various stakeholder relationships with organizations like the CNA, as you can see, JD with various members of our board last year, and other images, including of our current president, Tiffany, on the top right. So this just demonstrates some of the activities of the CNSA. Next slide.
Okay. Hi, everyone. Bonjour tout le monde. So I'll talk a little bit about CASN. So the Canadian Associations of Schools of Nursing that was founded in 1942. It is the national voice for nursing education, research, and scholarship in Canada. Its mission is really or mission and vision is really to focus on advancing excellence in nursing education to support the health of Canadians. CASN is a non-for-profit and voluntary association that currently represents 95 schools of nursing across Canada. Next slide, please. So maybe a little bit more about CASN. CASN really plays a critical role in upholding the quality of nursing education in Canada. It sets the national standards for education, ensuring accreditation of schools of nursing and their programs, and advocating for policies that support this excellence in nursing education. It includes being obviously politically active on issues that affect nursing education. One of the most recent examples has been CASN appearing as a witness at the House of Commons to discuss the effects of the reform on international student programs affecting nursing schools and their programs. CASN does set the national benchmarks that nursing school must adhere to ensure graduates are well prepared for the evolving healthcare system. And CASN also helps develop those resources for educators to meet these standards, also help educators connect from across Canada to discuss current challenges and innovations taking place in the field of nursing education. As a national voice for nursing educators and schools of nursing across Canada, CASN's strength really lies in its capacity to know what's going on clinically and in the education sector and how it affects the delivery of programs. And one way of doing that is to gather information. And one of the key surveys that we have at CASN is the student faculty survey. Every year, schools of nursing from across Canada fill out this survey to help us, or fill out the faculty student faculty survey to help us identify the trends and needs in nursing education, highlighting current shortages and projected needs for the upcoming future for the schools. So back to you, Leigh.
Thanks so much. We'll go to the next slide. And just certainly within my role as Federal Chief Nursing Officer, I rely on collaboration with the Canadian Association Schools of Nursing and Canadian Nursing Students Association and other groups that have broad representation from across the country. So we really want to provide some examples of how you can leverage the toolkit and use it in nursing education in a variety of ways. I think certainly it can be used. There's a real opportunity to use it when working with employers and healthcare agencies, knowing that we certainly have a workforce challenge today, and to find some positive strategies that other organizations have done across the country that can be used to really retain nurses and improve nursing workforce issues. certainly in discussion with students, in their advocacy. I think the most important role of students is to really find their voice and think about how they can be influential within their organizations or in influencing policy and in planning educational activities, as well as any policy work or advocacy that you may do in your respective roles. We'll go to the next slide, please. I will just say that this presentation is not exhaustive. There's lots more content in the toolkit. The toolkit is also available in both official languages. So really urge you to have a look at it and download it and find examples that are relevant to your practice context. So when we think about our workforce in Canada, nursing is the largest group of regulated health professionals with almost 500,000 nurses across the 4 categories of nurse in Canada. So we have nurse practitioners, registered nurses make up the bulk of our nursing workforce. We have also licensed practical nurses or registered practical nurses if you're in Ontario, and registered psychiatric nurses who formerly used to be in the Western provinces, but as a result of an Atlantic feasibility study, they are now going to be licensed in the Atlantic region, with Prince Edward Island being, I believe, the first jurisdiction to license registered psychiatric nurses in the Atlantic region. And certainly there's a variety of roles that nurses play, a variety of sectors in which nurses work. And I'll turn to Iyasu to just describe that a bit further.
Yeah, for sure. As Lee mentioned, the expansion of psychiatric nursing out of the Western provinces definitely show that the availability of I guess different nursing professions being expanded to different regions of the country is something we're seeing in greater numbers. And we're also seeing nurses taking up positions in various domains of the profession outside of maybe clinical practice, in other areas like advocacy, in research, administration. And this is quite an exciting time, and it definitely then leads to there being interest in how to best retain nurses in bringing together national leaders, as it was done in the development of this toolkits. So it's certainly an interesting time indeed.
Great, thanks so much. So we'll go to the next slide, please. I will just say that I often mention that, although nursing is the largest group of regulated health professionals in Canada, we have such a key role to play and are often most proximal to the point of care, which is why we really need to focus on the nursing contribution to care, because we are often intersecting most with patients, clients, families, and communities. So this is the wheel of the toolkit. We've called the toolkit Improving the Working Lives of Nurses in Canada. It does focus on these 8 core themes that you see color-coded in the outermost circle. And we think these are themes that impact a nurse's day-to-day working life in the domain of clinical practice. And then there are corresponding tools that employers can implement, and this is really key. The toolkit is not aimed at things that the individual nurse must do. These are structural and organizational changes that are needed from a pro-retention standpoint in terms of improving the working conditions of nurses. And although the toolkit was definitely created in the context of interdisciplinary team-based care, which is the world we all work and live in, there is a very strong theme of it being by and for nurses. I will say, though, that nursing doesn't own retention. These are challenges across health and social services and other, certainly other regulated health professionals, but there are some features that are unique to nursing. The themes are underpinned by the values that you see in the innermost circle, the values being respect, accountability, transparency, anti-racism, and anti-oppression. And you have the link to the toolkit there in the bottom. So we're just going to go into these 8 themes in a little more detail, but we will be sure to leave time for questions as well. So we'll go to the next slide, please. Okay, here's a different view. Here you can see all of the 8 themes, and then you can also see the goal statement for each theme. and then the initiatives under each theme as well. So all of the initiatives have 3 themes, with the exception of safe staffing practices at the very bottom, which just has 2 themes. And we're going to be going into this in a bit more detail in the slides to come. So we'll go to the next slide, please. Okay, so again, we put the themes in the form of a wheel because we really wanted to ensure that that they were iterative and there was no sort of beginning and end. But this is the theme of inspired leadership, which is really about empowering nurses of all levels, roles, and settings to experience fulfillment in their work and become leaders. And we really were intentional about differentiating leadership from management competencies in the toolkit, with the spirit that leadership is really about how we show up in our workplace, how we show up in a professional role, not about necessarily a particular title or role. So we've highlighted a couple of initiatives here as examples. I know we have colleagues from Quebec online. We've highlighted the nursing councils as in Quebec as a strategy for involvement of nurses and really trying to have nurses involved in decision making to impact change at an organizational level. We highlight the CASA National Nursing Education Framework, which really outlines leadership and core expectations for baccalaureate or undergraduate, master's, and doctoral nursing education. And then we highlight an example of a professional development program specifically tailored to nursing leadership and management, and that's the UNB's certificate program. So a couple of examples there and 3 different initiatives under this theme. We'll go to the next slide, please. So under organizational mental health and wellness supports, this is really about ensuring that we have access, that nurses have access to acute health and wellness supports with an urgency and focus on mental health and wellness supports, but also that we have zero tolerance for violence, bullying, and racism. So I'll turn to JD from Kazan to highlight some of the work that Kazan is doing on anti-racism.
Yes, thank you so much. Merci. So yes, sometimes it's difficult to visualize how do we actually implement or work on such thing as equity, inclusion, accessibility, and anti-racism. This is actually part of Kazan's strategic priorities, or is the first strategic priorities, is exactly this: to champion indigenization, equity, diversity, inclusion, accessibility, and anti-racism. And keeping this in mind, Kazan has recently published, in collaboration with the Canadian Indigenous Nurses Association, as well as the support of Health Canada, the revised cultural humility and cultural safety standards for nursing education. It's really setting the standards of what we should expect to see integrated in curriculums across Canada. Also, in line with this, in 2023, Kazan published its document promoting anti-racism in nursing education in Canada. And there's a little bit of a follow-up to this, and there will be an anti-racism survey that will be going out to all schools across nursing or across Canada in early March. And the survey really focuses on some of the taking action items that were highlighted in the anti-racism in nursing education document. Some of the key aspects that we'll be looking to address through this survey is addressing racism in curriculums, making racism visible, and optimizing students' success. And overall, we hope that through this survey, we'll be able to gather and offer resources that help schools of nursing working towards addressing racism, biases, and discrimination within nursing education. So hopefully building some tools. So moving from creating the documents to ensuring that we have the tools for implementation and change within schools of nursing. Next slide, please.
Actually, we'll just hover here for a second. Sorry, thank you.
All right. Yeah.
No, all good, all good. Maybe before, actually, can we go back to the yes, thank you, perfect. And I would just say, before I turn to Yasu to talk about the uni program in Alberta, I'll just highlight under moral distress and injury care, health PEI's example of essentially contracting or engaging with a third-party mental health support called Mind Beacon. And this is a great example because often nurses are skeptical to utilize the EAP supports within their own organization. So this was an example where Health PEI actually outsourced sort of EAP supports to provide better moral distress and injury care, and found that there was better uptake. So I'll turn to Yasu just to talk about the uni program in Alberta.
Yeah, so this is a very amazing initiative, as in it employs large numbers of third-year students going into their final year of study to essentially take on close to full-time hours as an undergraduate nurse employee. The naming may vary across the country. I know terms like externships as well as employed student nurse programs exist in other provinces. But the essential idea is acknowledging how hard it is for nurses to find the coverage to take time off during the summer. You can empower students to take on what's acceptable and safe within their scope and where they are within their program to build up this experience and work and enable this wellness that allows for greater retention. So it's very much a win-win example of an initiative that can support nurse retention. So yeah, it's shown very high uptake among students in the province I'm from.
Excellent. Thanks so much. So we'll go to the next slide, please. So this is the next theme, professional development and mentorship, which is really relevant and I think and key for this discussion here today. So this is about really lifelong learning and ensuring that there are organizational supports to support the nurse throughout the continuum of their career, their entire career span. And so we highlight a couple of examples here just on the theme of mentorship program. I know there's many folks from Ontario. Ontario had a massive investment in the Clinical Scholars Program, which is wildly popular in really having supernumerary supports, given the increasingly sort of novice composition of the workforce. And I've heard rave reviews from both clinical scholars and those who have benefited from the expertise of clinical scholars throughout Ontario. So great example of a provincial initiative to provide some mentorship and focused support. UBC also has a mentorship program. Other schools do as well, but we've highlighted one here, connecting senior nursing students with alumni as a means of bridging that gap and providing ongoing mentorship as they transition to practice. And we've also provided an example of the Ottawa Hospital's Clinical Coach Initiative. Again, other organizations across Canada are doing this, where they're actually training someone as a clinical coach. In the Ottawa Hospital, it was actually late career nurses who were given the focused training to be clinical coaches, and they're able to provide that at the elbow support for whether it's new grads or those transitioning into a new practice area. And often they're actually finding the answers together with the learner or with the new nurse. So very successful examples of mentorship programs. We'll go to the next slide, please. Okay, and maybe I'll turn to Jean-Daniel for this slide.
Yes, thank you. Still on the theme of mentorship, I think over the years, Kazan has been quite innovative in thinking about education on somewhat of a continuum that transcends institutional boundaries. And this is really explicit in the way that they've structured their strategic plan that really created a sort of priority where we need to create programs that enable nurses to thrive as they integrate the workforce. So it's not only about education that takes place, for example, during a 4-year degree. It is also about focusing on the transition to practice and how nurses are supported in the process. So reflected in Kazan's work, this has really taken on the shape of mentorship structures that support integration of nurses in the workforce. Next slide, please. So on the theme of mentorship, CASN has developed a nursing residency program that is currently funded by Health Canada and is given in partnership with employers across Canada, such as hospitals. And the purpose really of the program is to reduce transition stress, increase clinical competence of new graduates, increase successful workforce integration, and overall increase the retention of nursing graduates. So it's not only about thinking of production of numbers of nurses out there, but it's also thinking about the work environments in which they're going in and the supports that they're going to receive to remain employed in the health sector as nurses. So I can talk a little bit about the nurse residency program. It's really a two-step structure. So the first component is the preceptor mentor training, and the second structure will be the residency program itself. The preceptor mentor structure really is based on the idea that you want to give the tools to nurses who are working in the field to be able to support new graduates coming into the field and support them as they transition into their role. So when a nurse is selected from their institution to be a preceptor mentor, they follow 9 asynchronous modules. They have a facilitated discussion and have to do a short assignment. And then once this is all completed, so all the preparation to be able to support a new graduate, then they are paired up for 6 months with a new grad. So if you go to the next slide. So this is the 6-month long sort of residency program is that second portion of the nurse residency program, and focuses a little bit more on the new graduate, where the new graduate is paired up with a preceptor mentor, and during this time also takes part in some synchronous workshops where they're able to speak about specific aspect of the transition, so stages of the transition, some aspect of conflict management, time management, research utilization. So really applicable tools to help them integrate the workforce and also work with their preceptor mentor. So it's a really nice dynamic that is created to support the transition. And obviously right now we are engaging in the research and in the work. So we do have contact people for the research, but also if you want some more information, we do have all of this on the CASN website. Next slide, please. So as I said, this is a funded so right now we're receiving funding for the nurse residency program, and this helps us conduct research to see how this residency program is performing, or try to understand what the effects are of these types of programs. So we have Judy Duscher's team, or Dr. Judy Duscher's team, studying sort of the transition shock, stress response, integration into the workforce, and competency development. So they're doing some quantitative work, but also some interviews with preceptor mentors and those new grads to try to understand what their experience is with sort of the mentorship approach. We also have at the same time some work that's being done by Dr. Phil Jacobs, who's an economist or a health economist, who's really looking at, what is the return? What is the return on the value of this approach? And also, what kind of retention rates can we expect when we implement this type of program? So hopefully we'll be able to get some data over the next couple of years to show that this type of program is effective, and hopefully get some continued support to implement this type of approach. Next slide, please. This is also in line with the residency program that we have in place. We've adapted it to also create internationally educated nurse mentorship program. So it's a little bit of a shorter program, but has a little bit of the same structure. Instead of a preceptor mentor training, what we have is a mentorship training for experienced nursing that are currently working in field, and to help them, to prepare them to work with a nurse that has been educated at an international level and is integrating the workforce in Canada. So the modules that the mentor will be completing are adapted to working with somebody who hasn't necessarily been educated in Canada, and to better support their integration in the Canadian landscape. So, and there's also, yes, a 1 hour facilitated discussion, and then once the mentorship program is completed, then they will be working as a mentor with an IEN for 3 months. Next slide, please. So again, a little bit like the residency program, there's the mentorship aspect, and then or the mentorship training aspect, and then there's the support to the internationally educated nurse, who also, during that 3 month, work with the mentor, is supported by virtual synchronous workshops where you address topics such as transitioning to the Canadian system, developing resilience, applying best practices, and collaborating with other healthcare professionals. So it's really, again, trying to support the role of nurses in Canada. And again, there's our contact person for that project at Kazan, and the link to the IEN residency program. So all the information with respect to the program on our website. Thank you. We can switch slides.
Great. So we'll go to the next slide. It's great to see all the questions popping up in the Q&A. So again, under the theme of professional development and mentorship, we have a couple of additional examples of transition programs. We highlight McGill University Health Center's Genesis Nurse Residency Program, again, to support new graduate nurses as they transition to practice with a structured curriculum, mentorship, and specific clinical experiences tailored to their needs. We highlight the Shared Health in Manitoba Clinical Transition Program to help guide students in the nursing program through to their transition to practice, to graduation, and then the Kazan Nurse Residency Program you've just heard of. Next slide, please. Okay, I'll turn to Iyasu for this slide, please.
Yes, so this was a quotation taken from the full-length nursing retention toolkit, and the gist is just that it's very exciting to see that there's increasing recognition around the needs of new graduate nurses, as obviously between the very significant costs they're exposed to, between NCLEX preparation and registration expenses, applying for licensure, paying down loan debts, as well as being isolated from traditional support structures from, whether it be faculty or fellow nursing students. New graduate nurses are, of course, very vulnerable. So it is very exciting to see increasing recognition and validation of this issue, and how groups like Kazan, Health Canada, and various other employers are kind of coming together and seeing increasing adoption of these programs to ensure that the new generation of nurses that we are in the process of training, like myself, are able to be in the profession for as long as possible and not have their future careers be cut out due to some of the stressors brought on by the first few years of practice. So yes, thank you.
Great, thanks, Iyasu. And this is why we were really intentional about including students in the development of the Nursing Retention Toolkit, because we know that attrition happens in nursing education programs. When the service side of healthcare is strained, so too is the education side. And so although there's certainly a lot of focus on the transition to practice for new graduates, just in response to one of the questions that I saw in the chat, this theme in and of itself is intended to also address the needs of those transitioning at various stages of their career, like mid-career nurses who may be transitioning to a different professional role. So we'll go to the next slide, please. Thank you. Okay, so this is the last initiative for this particular theme, and we've just really been doing a bit of a deep dive into this theme because it's so relevant for this this topic today. And so this is the theme of career pathways and bridging programs, and we highlight a few different examples to support bridging or to support those who may be looking to transitioned from one category of nurse or one unregulated profession. For example, the New Brunswick Step Up to Nursing Initiative is for PSWs to transition to become licensed practical nurses, or licensed practical nurses to registered nurses. So different types of transition to practice, mainly focusing on education bridging programs in this in these three examples under this initiative. So we'll go to the next slide, please. Okay, reduced administrative burden. This is actually getting a lot of attention, this theme, and really trying to focus in on how we can free nurses up to do the tasks and care that they are uniquely competent and skilled to do. So we highlight the clinical extern program as an example of redesigning the work environment. There's extern programs around the country, but the extern programs are a great opportunity to get nursing students in the work environment to help ease that transition to practice, but also to ensure that the externs may do some of the other tasks, if you will, and other aspects of care that actually frees up the registered staff to focus on those key aspects of the nursing role. We highlight digital preparedness. So a great example is the Canadian Nursing Association's collaboration with the Canadian Nursing Informatics Association in developing a Chief Nursing Informatics Officer role. I would say few organizations have this specific role, but nurses are certainly involved in digital preparedness, and I hope this is something we continue to see, particularly with Gen AI and thinking about the key safeguards and guardrails that need to be considered when thinking about utilization of technology and digital tools within a healthcare environment. And then documentation requirements is another example of admin burden. We highlight the Horizon Health in New Brunswick. They have a forms committee, and this was intended to reduce duplication and really streamline documentation requirements. I think many organizations can attest that they're guilty of adding a new form without removing the other redundancies and other forms that may exist. So this is a great example of trying to ensure that nursing documentation requirements don't exceed regulatory requirements for documentation don't exceed organizational requirements. Next slide, please. Okay, so this is the last theme. Again, the themes are in a circle to not show any sort of rank or order to them, but this happens to be the theme also getting a lot of attention. We have there's two initiatives under this theme, and it really is about supporting a physically and psychologically safe work environment by ensuring that we have evidence-based staffing that reflects acuity, the experience of the nurse, as well as work-life balance. You've heard already about clinical supports like the Kazan National Nurse Residency program, and maybe I'll turn to Iyasu to talk about safe staffing frameworks and tools.
Yeah, of course. It's very clear that inadequate staffing not only worsens the outcomes of patients, but also is a major contributor towards attrition when nurses face moral injury and a stress over being unable to deliver the care that they wish to provide due to inadequate resourcing and staffing on their units. So this illustration by the CNA and CFNU, the evidence-based safe nurse staffing toolkit, provides various tools related to management of nursing workload and nurse care delivery models to help promote safe staffing practices. And we are seeing some recent advancements within Canada, as the province of BC recently had recently had a commitment by the province to set up minimum nurse-patient ratios in that jurisdiction. So it's very clear that not only from a patient perspective, but also from a provider perspective, minimum nurse-patient ratios and safe staffing is critical. And also from a student perspective, if I might add, it's has a very large impact, because when there is inadequate staffing and nurses are becoming burnt out and unable to care for the large assignment of patients they have, it worsens the experiences of students on the units, because they are unable to attain proper supports from, whether it be their preceptors or their staff nurses, because all of a sudden they're dealing with multiple patient assignments, charge responsibilities, and this just then further worsens the outcomes of the new generation of nurses we're hoping to recruit. So from multiple facets, this theme and this initiative of safe staffing is really critical.
Great, thanks so much.
Yeah.
Go to the next slide, please. Which I believe is also about you as well. He asked you to talk about the collaboration with CFNU.
Yeah, of course. And on the point of safe staffing, it is rather clear that as much as we want to focus on safe staffing, nurse retention, and new graduate attrition, it's clear we won't be able to attain any of that if students are struggling through to complete their program in the first place. And this has been echoed by various nursing student organizations who've been calling for greater supports in the form of financial assistance for nursing students. And what we then did on behalf of nursing students was the CNSA and the Canadian Federation of Nurses Unions launched a national study in the form of a survey that was distributed last fall. And we had over 3,500 responses from every province within the country, as well as 2 territories. And the key finding we saw was that there was overwhelming concern among nursing students around their financial well-being, as well as a considerable number of students, over 1 in 4, who have considered withdrawal from nursing studies because of financial difficulty. So just as we think of how it's critical to support new graduate nurses to prevent that attrition and to ensure that we're not losing anyone in that critical 1 to 3 year period of a nurse's career, it's equally relevant on behalf of policymakers, educators, as well as just nursing students ourselves, to think about how exactly are we making meaningful measures to ensure that nursing education is less precarious and more welcoming of students from all backgrounds and financial abilities, as is very clear, as demonstrated here, that the current status quo of supports aren't enough, and many students are being weeded through nursing school for reasons beyond aptitude and reasons beyond their likelihood to become a good practicing nurse. So that is a bit tied to safe staffing. So that was just something that I wanted to illustrate as a recent development. And I could share a link in the chat with more information for those interested. But I'll pass it back to Lee.
Great, thank you so much. I think that brings us to the last slide, if I'm not mistaken. We'll see. Yes. Hopefully we have really demonstrated collaboration in action here with close connection with the Canadian Association Schools of Nursing, Canadian Nursing Students Association, but you've also heard about other organizations like the Canadian Nurses Association and the Canadian Federation of Nurses Unions. And so, when we look at the rich kaleidoscope that is Canada, I really want to highlight the need for us all to collaborate and work together. I really am so pleased to see so many participants here today. And I know that there are certainly many challenges in the profession right now. But we are all responsible for uplifting the profession, and this type of engagement and collaboration is really key. So perhaps we can go to address some of the questions that have been populated in the chat. Maybe I'll perhaps start with Adam's question, and it's a really rich question. I probably can't do justice to it in the 13 minutes remaining, and I want to ensure that we get to some of the other questions. But in terms of, I'm often asked this question, so perhaps just to touch on a few things that are perhaps needed to change in nursing education. Um, certainly we love to see the toolkit integrated into curriculum. I think that's a wonderful, there's lots of resources in the toolkit that are evidence-based, and most of them are within Canada. So it's a wonderful opportunity to integrate that. But certainly, trying to future-proof nursing education, looking to the future. Some of the things that come to mind are preparation for future pandemics, climate emergencies, AI, the primary healthcare challenges that we have in Canada. And certainly that all will require changing models of care or changed models of care. And so again, there's some examples in the toolkit. Maybe for the next question, that might be a good one for Kazan, for Jean-Daniel.
All right, I'm trying to follow the questions as well. So are we looking at Peter's question?
No, sorry, in the Q&A, Andrea is asking about what efforts are in place to promote scholarships for nursing education to increase nurse practitioners from a professional development standpoint.
All right. I think I'm missing some. Oh, there you go. I am looking at the wrong thing. I was looking at the chat where people were putting, and that's so give me 2 seconds. So that was Andrea's question.
Andrea, yeah.
Okay.
Yeah.
Okay. Wondering. So from a professional development standpoint, I can definitely say that there are standards that are being developed for nurse practitioner programs in general. So obviously the question of scholarship, or are we talking about scholarships in terms of the scholarship of nursing, or actual scholarships in terms of supporting education? Those are two different things. If we're talking about the scholarship in terms of, how do we support them in engaging with scholarship, that is definitely part of the standards. And currently there are some very there's nationwide or conversation with respect to what will NP education look like in the future, considering that we are changing, or there's a change at the level of for licensure to a generalist. So there are quite a bit of conversations taking place to determine what will that look like in terms of education, but also in terms of how is it integrated into the workforce and in relation to a specialty model as well. So those conversations are taking place. In terms of promoting scholarships, in terms of money, in terms of support, I can speak to, or I know of different initiatives that exists, but they are not standardized across Canada. One of the models that exists in Ontario, for example, is the Learn and Stay grant. That is not applicable across Ontario completely, but in certain pockets, which supports both undergraduate and graduate education in certain fields. So where you have your education paid for, but you have to give back 2 years of your 2 years of work in the region where you completed your education. So there are little pockets here and there that have nice scholarship structures. but haven't heard of a unified approach to support NP in terms of scholarships for support for education.
Great. Thank you. So there's a question about how is Canada doing in terms of the nursing and medical hierarchy and nurses working to full extent of their license? Maybe I'll try to tackle that one and maybe turn to Iyasu for the next question, if that's okay. I would just say we definitely have a lot of work to do. Again, we have over 400,000, almost 500,000 nurses, 477,000 nurses in Canada. And the hierarchy is structural, and so it really does relate to our our models of care, our controlled acts models, and often the hospital acts in each jurisdiction. But there's a lot of work being done on nurses working to full scope of their practice, and that certainly is the case in rural and remote parts of Canada, where nurses are really optimized to the full extent of their license or registration. But I think there's a lot we can learn in urban centers. And I will say, because of the real concerted effort to shift to team-based models of care, it is breaking down some of those hierarchies. But again, lots of work to do. And apologies for the care that your elderly dad received in BC. Perhaps for the next question, I will turn to Iyasu.
Yeah, for sure. Policies around switching between days and nights would have to vary between specific employers. I know I'm currently completing my preceptorship, and there is no strong policy around having day and night shifts, like day and night shift like breaks in between, like beyond having 1 day shift, and it could be followed up by a night shift and vice versa. That's the experience of myself and other students. And I think that's also the same for among practicing nurses as well. So I would recommend you look into whatever province you're from and whatever health authority you are interested in, and they may have more explicit regulations around switches between day and night shifts. But I agree, it is highly stressful.
Can I just add to this a little bit, Yasu? I think again there's some nice examples in different pockets of Canada, or where there's different models of also how scheduling takes place. There are some that are more sort of hierarchical in that you're given a schedule, whereas there are some scheduling models that are a little bit more participative, where there's a sharing of or the implications of the employees in defining what that schedule will look like, so that it better meets the needs of the workforce. So that's just a little bit of an aside. There's also nice models out there that exist.
Yeah, and I think the toolkit is really key in highlighting the structural changes that are needed. Often I think there are organizational models that we can turn to for some of these things. Dr. Clune asked a question around the differences, and definitely there's probably a lot of focus on that transition to practice. It seems to be a very hot topic currently, but there's a lot that we can do to engage mid-career nurses in a different way. I think the Clinical Scholar program in Ontario is an example of that, but ensuring that there is engagement of nurses at that mid-career point. Other examples I think are highlighted in the toolkit. Maybe I'm wondering if Jean-Daniel, if you want to take, how can the nurse residency program be upheld given the institution challenges with low staffing?
Right. So I think the idea here is yes, to build capacity, and it's really trying to work with institution and meet them where they're at. So this program is coming in, and obviously your question speaks to, if we don't have a lot of nurses, working in that institution? Is it going to be more of a burden? Is it going to be harder to implement? So I think for us, it's really trying to work with the institution, meet them where they're at, and try to develop something that works. And I'm saying this sort of in the most general terms possible, because we're being approached by different groups to try to see how best to meet their needs. And right now we have a program that's funded and that is research based. So we have a specific protocol to follow. But as the program evolves, there are some modifications that we can bring to address specific needs. And if one of the challenge is the time required to help the preceptor mentor, do the modules, maybe there's a different way of delivering the modules to support their education while they're doing their work. So there's some nice things that are being discussed right now. It's also modifying a little bit the program, and we're seeing also that there's different needs. So yes, there is the transition to practice. There is the need for to support internationally educated nurses, but a little bit to the point of Dr. Laurie Clune before, there's also those mid-career nurses also that may want to transition into something different. So there's a whole idea of mentorship in those moments that are being requested by institutions, and on which we are thinking of collaborating. So I think for us, it's not necessarily to say that the fact that institutions are struggling right now as a sort of a barrier to implementation. I think it's more trying to work with the institutions to see what can be done to support the existing workforce in these types of programs.
Great. Thank you. I'm just mindful of the time. Maybe this question is around sort of definitions between preceptor and mentor in Canada. I believe we sort of scratched the surface of this in the toolkit, but I'm not sure if CASN has other resources around this.
To define both terms. I mean, I don't know if you saw, but in the way that we speak about preceptor mentor, the preceptor mentor has, or the way that we are using it, has more to do with the relationship with either a student nurse or a new graduate, whereas when we're talking about working with an IEN, it's really more of a nurse working with another nurse, so more of a mentorship structure. So we've differentiated like this, but I don't know if there's much more to the separation of the two in other documents, but this is how we are using it right now.
Okay, that's great. I'm and there's perhaps a request, maybe I'm reading it as a request for mentorship programs for faculty who have transitioned from clinical practice to the role of academic educators in schools of nursing.
Hear it loud and clear, and I think if you go in different institutions, you'll see that there's often some internal mentorship structures that are provided within the institutions to try to adapt or survive the first few years of or even later on in your career, to sort of work through some of the challenges or even ideas that you're having within your work environment. So I think those are there, but I'm hearing you as to some of the potential work that could be supported in these types of transition for faculty. Thank you.
Okay, I'm mindful that we are at time, but this was such an engaging session. So I really want to say un gros merci. Thank you to everyone for joining. Please use the toolkit for your advocacy, for your educational offerings, and really as a great Made in Canada resource on the current nursing health workforce challenges. Please have a look at the CASN and CNSA websites for additional information, and And really thank you for all of the engaging questions today and for the comments in the chat. Merci beaucoup tout le monde. Thank you.
I just want to pop in and say a final thank you to you, Dr. Chapman, Yasu, and Jean-Daniel for such a wonderful and engaging presentation. We will make the recording available with the slides in the coming days. And I also noticed there were some questions about some of the documents that were mentioned throughout the presentation. So we'll send those links in an email as well. So thank you very much, everyone, for joining us today.
Yes, thank you. And I also see that there's some fantastic questions about rural and remote nursing. And yes, that is on the agenda of Kazan. We are reigniting working with that committee. And I think there's some wonderful topics that I'm hoping to follow up on with the Kazan National Office, whether it's paid placements that are being highlighted. So maybe I'll be able to work a little bit with ASU and CFNU on those topics. Thank you so much.
Yep, likewise. Thank you very much, everyone, for attending this webinar. If there's any students still on the call, I definitely encourage you to be involved with the Student Association, be involved with the CNSA. I think we're just starting making very interesting progress along the topic of paid placements and student financial insecurity. So while you're still a student, I encourage you to stay involved and feel free to email me if you ever have any questions about anything that was said during this webinar. So thank you so much.